I did my first like kind of walk jog the day after 12 weeks with the the go ahead from my PTs for sure. And yeah, and so I've run 3 times now, in a walk run kind of returning to running program, no pain. My name's Kraig. I had a right knee long-term issues from a couple of surgeries that I had in the 80s. Torn meniscus, an attempt at a meniscus repair, and then when that didn't take, some meniscus removal. And then I was healthy for a long time through kind of a long history of endurance sports, a lot of miles on the legs, Ironman triathlon, marathons, ultra marathons, and then just over the last since about like 2017, 2018, this decline in that right knee, pain in the right knee, most specifically for running. So I had to slow down my running quite a bit. 2017, 2018, still doing, an Ironman every other year, running a fair amount of ultra marathons, and then in 2019, I did Ironman Mont Tremblant, and then at about halfway through the marathon, it became apparent that I really just couldn't run longer than like 13 or 14 miles anymore. And so again, got to like halfway through the marathon, and then it was just like quite a bit of walking to the finish with a little bit of running mixed in here and there. And then that was kind of the realization that I really needed to seek out a solution to what was going on with my knee. Yeah, my doctors in Bend, who I think are fantastic, were like, you should really make this last as long as you can before you get a total knee replacement, because I'm, in my early 50s, so still fairly young. And so that was basically the prognosis, like until you can't handle it anymore, then get a total knee replacement. So that's when I started to seek out other options. Prior to just like the running decline of the knee, pretty darn active. I live in a city that has a lot of outdoor activities, and we like to play outdoors. So swimming, biking, running, snowboarding, Nordic skiing, paddleboarding, all the things. And really the knee is good for, or prior to the surgery, it was good for most of those things. It was really just like volume of running that I couldn't do anymore. Like cycling, it was totally fine. Most things, totally fine. But running is important to me. It's an important part of my lifestyle, and specifically trail running, which actually became the most difficult. Running on uneven surfaces was like the hardest thing on my knee. If I had like the right shoe on and I was on like a controlled paved surface for the most part, for distances of up to 7-8 miles, I was totally fine. But I couldn't run on the dirt anymore, and that's really important to me. I mean, so far, my recovery has been amazing. I mean, I'll tell anybody that wants to hear about how happy I am with the service I got here from my PTs back home. It's been pretty phenomenal. And, I just returned to running last week. So my 12 weeks post-op was last Tuesday, so I'm a little over 13 weeks now. I did my first like kind of walk jog the day after 12 weeks with the go ahead from my PTs for sure. And and so I've run 3 times now, in a walk run kind of returning to running program, no pain. Just like working on getting back strength and endurance. And my return to cycling is another one of my first loves. So just meeting with Allison today for my test, told her, I was like, I'm a little stiff and sore because I rode 20 miles on my mountain bike yesterday with 3,000 feet of climbing in the mountains. And that was my hardest ride to date, but cycling is like pretty much back to what it was before, with just a little bit of like getting some strength back. Totally. I was even really starting to kind of plot my 2023 schedule when I was in San Francisco post-op. So obviously I don't live here, so I basically lived in San Francisco for 2 weeks for my surgery and afterwards. And so as I'm laying in bed those days rehabbing, coming here every day for PT, and then going back to the hotel and sitting around thinking about what I'm going to do next year. Like, how do I return to activity and the things that I love? So I've already registered for an Ironman 70.3 in April, and then I will register for full Ironman for next November. In the coming months, as soon as it opens for registration on, and then a whole mix of the other things that I do: mountain bike racing, cyclocross racing, and then I definitely want to do some trail run races. Nothing like, I don't really have the desire to return to ultramarathon, but going out and running a trail half marathon or 30K or something like that, those are all on the list for next year. What I do, where I work through Run Specialty, I have a really close relationship with a lot of the best PTs at home. And then, I've been an endurance coach and a personal trainer, and so I've been involved in fitness for a long time. So I have pretty good awareness of my own body and how to rehab it, and then I really trust when I have great professionals helping me to rehab it as well. My care here was phenomenal. Like, it was. I think you think of surgery and you kind of dread having surgery, and then the pain of rehab from any kind of injury. But coming here every day afterwards was a joy. The PT team here is phenomenal, and then you really kind of create this close relationship with the guys that had surgery the same day as you. So I've become friends with one specific guy who had surgery the same day as me, and we were in PT every day together. We've already gotten together outside of physical therapy here, and then just the transition to my own physical therapist at home, and good communication as far as what I should be doing from the clinic here to up there. And coming back today was really fun. I was joking with Allison, it's like a high school reunion, because a couple of the guys that I had surgery with are here, and then just seeing everybody in the clinic again, it's really fun. This is an awesome place. Yeah, I would just say that if you haven't gotten a second opinion or a third opinion, or done some research as to what else is out there, don't take for granted that what one doctor says is, the end of running or the end of whatever it is that you do because of an injury or some wear and tear. Make sure that you've exhausted all your resources to figure out if there's a better solution, if there's an alternative to what you've been told, because there probably is. Again, and I've had this discussion with so many people already, just like the service at this clinic from start to finish, and I'm not even really sure that there is a finish, because you just keep checking in and continuing to make sure that everything is working. It's pretty unbelievable. It's an amazing place to have work done.